Hi, everybody. This is Monica Heltz, your public health director. I just wanted to give you a few words about how we selected our metrics. I know that we presented on this previously. You can listen to our full presentation to the school board that happened last Friday. That's linked on our website. As stated before, they were based on recommendations from the Harvard Global Health Institute, the CDC, and the WHO for controlling the spread of the outbreak. However, I will mention that we shifted the green and yellow categories slightly for the case incident rate measures as well as for the percent positivity measures. And again, that only affects the green and yellow categories. And I'm going to go into why we did that. But the baseline metrics from those recommendations from WHO are less than 3% positivity would be a green, less than 5% would be a yellow. And for the case incidence rate, less than 1 per 100,000 would be a green, and 1 to 9 would be a yellow. So just for full transparency on that. So after we carefully considered those recommendations from those entities, Dr. Lane and I made a conscious and fully informed decision to shift those metrics slightly based on a couple of other reasons. One is that we recognize that this outbreak is not just about an infectious disease. The pandemic has cut deeply into people's lives, their livelihoods, their mental health, their home lives, and their relationships. Currently, about 1% of Fishers residents have tested positive for COVID, yet it has affected 100% of us. We recognize that public health is informed by these factors, and we have to consider all of these factors. Since we have a more healthy, younger population with less risk factors and generally less socioeconomic constraints, we expect that we will not only be more resilient due to the challenges that we face from virtual learning and from the economic hardships and other new norms of this pandemic, but we also expect that we'll suffer less physically in regard to this virus than many other communities will. Additionally, we recognize that public health decision-making at this level must be informed by the metrics and that those metrics include this other data. Also, we recognize the serious consequences of the extended isolation that is happening for many populations, and that includes children as well as some of our at-risk residents. We know that this affects mental health concerns that may already be happening, and we also recognize that the risk factor of mental health illness is one that Fishers residents do not do as well in as we do in many other categories. So although we were ranked first in the state as a county, and our Fishers metrics are even better than the county as a whole, our mental health indicators are not first in the state. So we recognize all of these factors and in shifting these guidelines so that we could allow for things to happen that would affect those other parts of our lives. We have not shifted any metrics on the orange or the red level, which many other communities have done. For example, Marion County has shifted their close everything down level, at least for schools, to up to 15%, and we have left that at 10%. So I just want to be really clear about that we would love to be in a great situation. We would love for the state and the community to have been in a place where we could be starting schools at a less than 1% positivity rate, like we're hearing about in New York. But that is not the situation here. So what we're trying to do is carve a path through the middle of where we need to be based on all of these factors. So that was a rationale for changing those metrics. I would also mention that we saw additional input on these metrics from our colleagues in public health, infectious disease, and pediatrics. And the feedback that we received was that they were very reasonable, if not conservative. So I just want to make the very real point that that these metrics were very carefully considered and that we are taking into account a variety of different factors when we made that conscious decision to to go with the metrics that we have chosen for our community based on the needs of our community. So I just want to make that really clear in case there was any question about that. If you have any questions about any of those other things that I mentioned, feel free to contact me. Thanks.